Hello, we are going to be discussing the utilization of blood flow restriction therapy for a case of stress urinary incontinence. So, blood flow restriction therapy, or BFR, is a modality that can be used to stimulate muscle growth and to improve endurance. It has been used extensively with the ACL population, but not so much in pelvic floor. So the case involves a 54-year-old postmenopausal woman. The postmenopause is significant because she would have diminished levels of estrogen, which leads to muscle loss and muscle weakness. And in her case, the muscle weakness was affecting the pelvic floor. So she was having symptoms of urinary frequency, urinary urgency, and stress urinary incontinence. She had secondary issues in her hip and sacrum, and this is significant because the hip and the back are highly correlated with pelvic floor dysfunction. So our clinical findings were increased pelvic floor muscle tone. That basically means that we have a firmer muscle feel to palpation. She had weakness and she had tenderness in various muscles. So what do we do? A plan of care for this sort of patient involves what we call pelvic floor downtraining, pelvic floor relaxation, pelvic floor lengthening, and we also routinely use lumbopelvic strengthening. So how did we do? She did have improved pelvic floor strength. She did have improvement in her urge and frequency. However, she was still leaking with hiking and walking, and that was bothersome to her. So we decided to use 8 sessions of BFR, which has been demonstrated in the literature in one prior case. This is the placement of the cuff for utilization at the hip. BFR will affect the muscles distal to the cuff as well as the muscles proximal to the cuff. So this positioning would work on the hip and therefore would work on the pelvic floor. We chose these 2 exercises because they have been used in other research on stress urinary incontinence. So how did we do after the BFR? Well, her outcome measures both improved significantly, but more importantly, our patient reported that she was able to return to full activity, including walking and hiking, without any leaking. So we are concluding that BFR may be a useful tool in lumbopelvic strengthening to improve pelvic floor symptoms. Of course, this is just one case and further study would be needed. Thank you for joining me.